Welcome back to my channel. And if you are visiting this space for the first time, you are also highly welcome. In this lecture, we'll be looking at the superficial perineal pouch. I'll put up a lecture on the deep perineal pouch. If you've not checked up that lecture, please kindly go and do so. Let's try and use this image by the side to illustrate where the superficial perineal pouch is located. If you look at this image, the configuration at this point is the pelvic cavity. And we know that the pelvic cavity is inferiorly limited by the pelvic diaphragm. And this is what is highlighted here in purple. Inferior to the pelvic diaphragm is where we have the perineum. So this is the region here carved out in black. We know that the perineum is further subdivided into an anteriorly placed urogenital triangle and also a posteriorly placed anal triangle. And at this point here, that is demarcated in dotted black, is where we have the subdivision created, of course, around the perineum. So anteriorly at the front, we say we have the urogenital triangle, while posteriorly we have the anal triangle. It is within the anteriorly placed urogenital triangle that we have the deep and also the superficial perineal pouches. So this region here that is harrowed here in green is where we have the deep perineal pouch, and this is represented as DPP. And of course, is located deep within the perineal space. While more superficially, we have the superficial perineal pouch. And this is what is harrowed there at this point. And this is represented with SPP. This lecture will be focusing on the superficial perineal pouch. We would be looking at the boundaries of the superficial perineal pouch and also the structures that are contained within it. So ride on with me. So the superficial perineal pouch is a potential space that is located between the perineal membrane and also the colles fascia. We try to use this image for illustration. We say that this is where we have the pelvic cavity. We say that the pelvic cavity is limited by the pelvic floor or the pelvic diaphragm. And this is what we have here highlighted in purple. Inferior to this space, we say we have the perineum. This is the perineum here carved out at this point. It is a diamond-shaped configuration or space that is located inferior to the pelvic floor or the pelvic diaphragm. I've also put up a lecture on the perineum. If you've not checked that out, please kindly go and do so. We said that this perineum is further subdivided into two triangles. Remember, we said that the perineum is a diamond-shaped configuration. And at specific regions, it is further subdivided into two triangles. So we have this demarcation created here in dotted black. So anteriorly at the front, we have a triangle that is referred to as the urogenital triangle, while posteriorly behind, we have the anal triangle. We say that the deep and the superficial perineal pouches are located within the anteriorly placed urogenital triangle. So this is where we have the placement of these two pouches. If you look at this structure here that is harrowed here in green, this is the deep perineal pouch. The deep perineal pouch is structurally made up of the urogenital diaphragm, which is what is highlighted here in green. This urogenital diaphragm is superiorly covered and also inferiorly covered by the fascia of the urogenital diaphragm. So superiorly, we have the superior fascia of the urogenital diaphragm, and this is what is highlighted here in yellow. While inferiorly, we have the inferior fascia of the urogenital diaphragm, and this is what is highlighted here in red. So you see that the urogenital diaphragm covered superiorly by the superior fascia of the urogenital diaphragm and inferiorly by the inferior fascia of the urogenital diaphragm is what makes up the deep perineal pouch. And you see that it is the deep perineal pouch because it is a space that is located deep within the perineal space. We say that this is the perineum, so it is located deep to this space, and this is where the name is so drafted from, the deep perineal pouch. So this is where we have the inferior fascia of the urogenital diaphragm that is harrowed here in red. This inferior fascia of the urogenital diaphragm is also referred to as the perineal membrane. So this is what is seen at this point. Between the perineal membrane and also the colles fascia that is harrowed here at this point is where we then have the superficial perineal pouch. So this is where we have the superficial perineal pouch here. And it is superficial perineal pouch because it is a pouch that is located superficially within the perineal space, just as the name implies. So you see that we have two pouches, but these two pouches are limited to just the anteriorly formed urogenital triangle. And this is what is captured here in this image. Let's drive further to explain the emergence of the colles fascia. If you look at this upper region, this is where we have the lower abdominal space. And at the most external region, we have the skin. And this is what is seen to be harrowed here in black. The skin is also seen to extend down to the perineal region. So we also have the skin forming the most external limit around the perineal region. Deep to the skin, the next structure that we have is the superficial fascia. The superficial fascia is the layer that is seen deep to the skin, and around this space, it is further subdivided into two subregions. So we have the outer fatty layer and also the inner membranous layer. So if you go back to the lower abdominal space up here, deep to the skin, the first layer that we have is the outer fatty layer, which of course is a sub-layer of the superficial fascia. And this is what is harrowed here in blue. This outer fatty layer is referred to as the campus fascia around the abdominal region. While the deep membranous layer of the superficial fascia is what is harrowed here. And this layer is seen to be located deep to the outer fatty layer. And this is specifically referred to as the scalpus fascia. These two fascia are sub-regions or subdivisions of the superficial fascia. Of course, the superficial fascia, we say, is seen to lie deep to the skin. So this is the configuration that you have around the space. This alignment also follows suit through along the perineal region. So along the perineal region, we say that the most external structure is the skin. And this is what is harrowed at this point. We say that deep to the skin, we have the superficial fascia. The superficial fascia also around the perineum is further subdivided into two sublayers. We have the outer layer and we have the inner layer. The outer layer at this point is what is seen to be harrowed here in blue. But specifically, if you go back to the abdominal region, we say that the outer layer is made up of fatty tissue. And this is why it is referred to as the outer fatty layer. It is specifically referred to as the campus fascia around the abdominal space. So when it gets to this region, around the scrotal region, this fatty deposit is replaced by muscle strands. So you have fibers of muscle around this region, and this is referred to as the dartos muscle. The dartos muscle is seen to be replacing the outer fatty layer that is seen to run down from the abdominal space. If you go deep to the dartos muscle, you see that this dartos layer is lined upon a fascia. And this is the deep layer of the superficial fascia. So you see that the deep layer of the superficial fascia around the abdominal space is the scalpus fascia. And as it runs down, it becomes transformed or replaced by the dartos fascia. And this is what is harrowed at this point. You see that this same alignment, of course, is seen to run from the abdominal region down to the perineal region. Although at different regions, there is a form of transformation. And this transformation, of course, leads to the generation of the specific names that we have highlighted. So if you look through this region, if you go more superiorly, still around the perineal region, around this point, you see that the dartos fascia will become continuous as the colles fascia. So around this upper region where we have the superficial perineal pouch, you see that the inferior limit here, we then have the colles fascia. The colles fascia is now a transformation that is seen around this region from the dartos fascia. So this is why we say we have the superficial perineal pouch located between the perineal membrane, which of course is at the superior limit, and the colles fascia, which of course is creating the inferior limit. So it is sandwiched between these two fascia. Let's go through this slide to look at the boundaries of the superficial fascia. Also using this image by the side, we already know that we have the pelvic cavity that is limited by the pelvic floor, the pelvic diaphragm. This is the configuration that is presented here. And we know that inferior to this space is where we have the perineum. We say that within the perineum, we have further subdivision into two triangles. We have the anterior urogenital triangle and the posterior anal triangle. We also say that the deep and the superficial perineal pouches are located within the urogenital triangle, which of course is seen in the anterior part. And this is why you see this pouch is located in the anterior region of the perineum. In the perineum, within the urogenital triangle, we have the deep perineal pouch, and this is what is harrowed here in red. We already described the configuration of the deep perineal pouch in our previous lecture on the deep perineal pouch. And superficially harrowed here at this point is where we have the superficial perineal pouch. If you look at it in the anterior region, you see that there's an opening or a deficit created. And this deficit is what allows the connection of the superficial perineal pouch with the abdominal space. And as a result of this, there could be the spread of infection because of this opening that is created around this region. So we can say that the superficial perineal pouch is not a closed pouch. It is not a completely closed pouch because of this deficit that is created in the anterior part. So if you go more posteriorly behind, you see a closure around the posterior region of the superficial perineal pouch. And this closure is as a result of fusion between the colles fascia and also the posterior free surface of the perineal membrane. And this is what is demarcated here at this point. So you see that the superficial perineal pouch is opened anteriorly, and this is where it becomes continuous with the abdominal space, while posteriorly, because of the connection or the fusion that is seen between the colles fascia and also the perineal membrane, you have a closure around the posterior region. So it is closed posteriorly, while anteriorly it is opened. And this is what is seen to be harrowed at this point. On the lateral side, you see that the superficial perineal pouch is limited by the ischiopubic rami. Remember that the anteriorly placed urogenital triangle has its two lateral walls limited by the ischiopubic rami. And this is what is also seen to limit the superficial perineal pouch laterally. So let's use this slide to describe the contents of the superficial perineal pouch. Within the superficial perineal pouch, we have a number of muscles. We also have viscerals. Then we have neurovascular structures. We'll be taking each of these components one after the other to describe how they run and how they are able to be positioned within the superficial perineal pouch. First, let's drive through the muscular components of the superficial perineal pouch. Within the superficial perineal pouch, for both the male and the female, we have differences in terms of the muscular component of the superficial perineal pouch, even though we have similarities in the way they are presented. So in the male superficial perineal pouch, what we have is the root of the penis. We know that the penis is an elongation that is seen to emerge from the perineum. And we should expect that the root of this structure will be taped down onto the superficial perineal pouch. And this is why we have structural components forming the root of the penis located within this space. While in the female, we have the clitoris. So we'll be driving through this slide to establish the specific structures that are located in both the male and also in female. For a male, we have the root of the penis structurally made up of the bulb and also the crura. The root of the penis is formed by a triradiant structure, which means that a three-pattern structure that is seen to emerge around the space. So around the central region, we have the bulb of the penis. This is the bulb of the penis here, harrowed at this point, and this is an erectile tissue. So you see it emerging around the central part, and you see this bulb-like emergence around its root. So this is referred to as the bulb of the penis. On both lateral side of the bulb of the penis, we have the crura of the penis, and this is what is harrowed here in black. We have two. We have one on one side, and we have the other one on the other side. So we have one bulb of the penis, while we have two crura of the penis. And these two crura of the penis are located one on each side of the bulb of the penis. These structures are erectile tissue, and this is what extends to reach the shaft and also the glans penis. These erectile tissue are not left open. They are seen to be padded up by a number of muscles. So you have this bulb and the crura also with its associated muscles, also located within the superficial perineal pouch. So let's look at the muscles that are seen to lie upon the bulb and also the crura of the penis. For the bulb of the penis that is centrally placed, you see a number of fibers running on both sides. You have a collection of fibers on one side, and you have another collection of fibers on the other side. And you see that they tend to meet along the midline plane where they form the midline raphe. So we have the bulb of the penis that is now lined by the bulbous spongiosum. The bulb of the penis is just one structure. It is an erectile tissue, of course, that is seen around the central part, where we have the bulbous spongiosum, which is a pair of muscle with the strands running on both sides and, of course, meeting along the midline plane. So you have a pair of bulbous spongiosum, of course, overlying onto the bulb of the penis. We also have the cura of the penis, which are also erectile tissue on both sides, and these structures also need to be protected. And this is why they also have muscles also lining upon them. So we have the ischiocavernosus. You have one pair. So you have one covering the surface of the cross of the penis on one side, and you have another running over the cross of the penis on the other side. So you have the ischiocavernosum, of course, lining over the two cura that is located on both sides of the bulb of the penis. So we can say that within the superficial perineal pouch in male, we have the bulb and also the cura of the penis. And we also have the associated muscles. So this muscles is what we have highlighted using this slide. In the female, it appears to be similar, but of course there are distinct differences. So let's try and use this image at the inferior side to illustrate this structure. The anteriorly placed urogenital triangle is where we say we have both the deep and also the superficial perineal pouch. And this is what is carved out here at this point. While at the posterior end, we have the anal triangle. The superficial perineal pouch is seen on the outside because it is superficially placed. When deep to this space is where we have the deep perineal pouch. The deep perineal pouch is not seen in this image because it is located deep within the perineal space. So this is where we have the superficial perineal pouch also in female. And if you look at this structure that is harrowed at this point, is where we have the bulb of the vestibule. Thus, a corresponding neck structure that is seen also in male. If you go back to the bulb of the penis in male, you see that the bulb of the penis is a single structure. And of course, it is seen to be centrally placed. If you look at the bulb of the vestibule in female, you see that there is a split. And this split is to create an opening for both the urethra and also the vaginal canal. Because of the peculiarity between the male and the female reproductive system. In the male reproductive system, there is no opening for the vagina and the urethra around this space. The urethra is seen to run along the length of the penis. So what occurs in female is that the opening will be created around the space where the urethra and also the vaginal canal will be able to open into. And this is where you have this splitting pattern of the bulb of the vestibule. And this is what is seen around the space. So you have one limb on this side, you also have another limb on the other side. You can see the distinct differences. So you have this structure here, highlighted here in purple. But this region, the bulb of the vestibule is covered by the bulbous spongiosum. So you have these two structures around the space. While laterally, you have the cura, and this is what is saying to be harrowed here in black. We say we have two. We have one on this side and you have another one on the other side. And this cura also in female is covered by the ischiocavernosus. So you have the ischiocavernosus muscle covering the cura of the clitoris, also in female. This kind of presentation, remember we have it in male and it's also covered by the ischiocavernosus. So also in female, you have the cura also covered by the ischiocavernosus. So at this region, you have two, you have one on this side and you have another one on the other side. So you have the ischiocavernosus. From the name, it means the muscle that emerges from the ischium. We know that the ischium is a sub-region of the hip bone, and you see its emergence from this lateral side, of course, going forward to be inserted onto the cavernosus, which of course is the erectile tissue. So that is how the name is being drafted from. So its kind of presentation is also seen in male, and this is what exhibited in female. The only distinct difference that is exhibited around the muscular component is in the bulb of the penis and also the bulb of the vestibule. We know that the bulb of the penis is seen as a single structure around the central emergence, while the bulb of the vestibule is seen as a structure that has a split, creating an opening for the vaginal canal and also the urethra. Then the next muscular content that is seen within the superficial perineal pouch is the superficial transverse perineal muscle. If you try to use this image up here, this is where we say we have the male perineum, And this structure here that is harrowed here in blue is the superficial transverse perineal muscle. We have two. We have one on this side and we have another one on the other side. This superficial transverse perineal muscle, you see it emerging from the ischial tuberosity, and you see the fibers are directed medially, and this is where they are seen to insert onto the perineal body. So you have one emergence from one side, and you also have another emergence on the other side. Remember when we described the deep perineal pouch, we also established the deep transverse perineal muscle. This is the deep version of this muscle. This is located within the deep perineal pouch, while the superficial transverse perineal muscle is seen in the superficial perineal pouch. And this is what is harrowed here in blue. And we also have the superficial transverse perineal muscle also in the female superficial perineal pouch. So if you use this image down here, this is where we have the superficial transverse perineal muscle, also harrowed here in blue. As we have the presentation in male, so also we have in female. So you see it emerging from the ischial tuberosity, and you see the fibers moving transversely or directed transversely towards the midline plane, where it will be inserted on the perineal body. So you have one on this side and you have the other one on the other side. Of course, it is located within the superficial perineal pouch, and this is why it is so named the superficial transverse perineal muscle. It is superficial and is transversely placed, of course, located within the perineum, and this is where the name is being drafted from. So these are the muscular content of the superficial perineal pouch. We know that basically we have the erectile tissue, which is structurally made up of the bulb and also the crura. Then we have the associated muscles that are seen to overlie it. Then finally, we have the superficial transverse perineal muscle. So it's good for us to be able to highlight the different types of muscle that are seen within the superficial perineal pouch, and also stating the distinct differences that we have due to the orientation of this muscle or structures within the male and also the female superficial perineal pouch. So now let's go through the viscerals. We've tried to use our previous slide to describe the muscular content of the superficial perineal pouch. For this slide, we'll be looking at the viscera that are located within the superficial perineal pouch. We also have distinct differences based on the male and the female superficial perineal pouch. For the male, we have the urethra. We also have the urethra also in the female, but we have specific regions of the urethra, and it's good for us to be able to highlight this. But the specific region that we have in male is the spongy part of the urethra, while the specific part of the urethra in female that we have within the superficial perineal pouch is the inferior region of the urethra. Let's try and use this image up here to illustrate the specific region of the urethra that is seen within the superficial perineal pouch. This image up here is the superficial perineal pouch in male, and this structure that is located at the central part here is where we have the bulb of the penis. Remember, we described the bulb of the penis in our previous slide when we tried to highlight the muscular content of the superficial perineal pouch. So you have the urethra running through the bulb of the penis around this region, and this is what is seen to be highlighted here in yellow. So it runs across the bulb, that is where we have the root of the penis. You see it running along to the shaft and finally terminating at the glans penis. And this is what is represented here in yellow. So you see that it is the spongy part of the urethra that is located within the superficial perineal pouch. But specifically, it is the upper region of the spongy urethra or the penile urethra that is located around the space. If you also try to use this image down here to further illustrate the specific region of the urethra that is located within the superficial perineal pouch in male, this is where we have the pelvic cavity. Within the pelvic cavity, we have the urinary bladder, which of course is a temporal storage site for urine after its production in the kidney. So after the storage, when it is time to release the urine, this urine will be released through the urethra. And this is what is seen to be highlighted here in blue. So you have the urethra, of course, extending from the urinary bladder. You see it running through the penis before it is finally released or emptied to the external environment. This urethra in male is seen to have specific region. We have a region that is located before the position or the location of the prostate gland. And this region here that is harrowed at this point is referred to as the preprostatic urethra. This preprostatic urethra is a specific region of the urethra that is located before the prostate gland. And this is why it is so referred to as the pre-prostatic urethra. This structure here that is highlighted here in yellow is the prostate gland. You know that the prostate gland is located around the exit of the urethra. So you see it surrounding the urethra just after it emerges from the urinary bladder. And there's a specific region of this urethra that is seen before the prostate gland. And this is referred to as the pre-prostatic urethra, just as the name implies. Then the second sub-region of the urethra is the prostatic urethra. And it's so referred to as the prostatic urethra because it is the region of the urethra that is seen to line or run through the prostate gland. And this is what is arrowed here in yellow. The next region after the prostatic urethra is a short membranous urethra. And this is what is highlighted here at this point. This membranous urethra is what is seen to pass through the deep perineal pouch. We describe the membranous part of the urethra as part of the structural component of the deep perineal pouch in our lecture on the deep perineal pouch. So immediately after the membranous part of the urethra, the next region is the penile or the spongy urethra. And this is what is seen to be arrowed here in black. The penile of the spongy urethra is the region of the urethra that lines or runs through the penis. And this is what is so referred to as the penile or the spongy urethra. So this spongy urethra is seen to be located within the superficial perineal pouch. This is where we have the superficial perineal pouch here. And you of course see that it is the spongy or the penile region of the urethra that is seen to run along the space. But specifically, it is the upper part of the spongy or the penile urethra. The remaining region down here is seen to run through the shaft of the penis or the body of the penis. Then finally, you see it within the glans penis before it is released to the external environment. Then for the female, we have the inferior region of the urethra. If you try to use this lower image, this is the superficial perineal pouch in female, and this is the anteriorly placed urogenital triangle where we say we have the location or the position of the superficial perineal pouch. If you look at this space around this region, this is where we have the opening of the urethra. And this opening of the urethra, of course, it is at the most inferior region. The most superior part of the urethra will be located up within the deep perineal pouch. And we've tried to highlight this in our lecture on the deep perineal pouch. So you see that the specific regions are seen to run and also form alignment as it relates to the deep and also the superficial perineal pouch. This opening of the urethra is seen around 2 centimeters from the glans of the clitoris. This is where we have the glans of the clitoris here. So if you try to do the measurement from this region, you see that the opening of the urethra will be located about 2 centimeters from this space. And of course, in addition to the viscera that are located within the superficial perineal pouch in female, we also have the opening of the vaginal canal. And this is what is seen to be arrowed here in blue. So posteriorly behind, we have the opening of the vaginal canal in female. And remember when we try to describe the muscular component, when we describe the bulb of the vestibule, we say that the bulb of the vestibule is opened in the superficial perineal pouch of the female. This is to allow or create an opening for the exit of the urethra and also the vaginal canal. And this is what is presented here. So in addition to the urethra in female, we have the vagina. We also have glands as part of the visceral content of the superficial perineal pouch. In the male superficial perineal pouch, we do not have glands, while in the female, we have a gland located within the superficial perineal pouch. And this gland is the Bartholin's gland. So if you try to use this lower image here, by the side of the opening of the vaginal canal, we have 2 Bartholin's glands. You have one on this side, and you have the other one on the other side. And this is what is seen to be highlighted here in yellow. These Bartholin's glands are seen to open into the wall or the interior wall of the vaginal canal. And this is what is also represented here in this image. So you have them secreting their content and finally releasing it into the interior space or the internal space of the vaginal canal. And this is where they help to lubricate the internal wall of the vaginal canal, because the internal wall of the vaginal canal needs to be lubricated. And this is what produces this substance. So if we go back to the male, in the superficial perineal pouch in male, we do not have glands. The only structure that is contained within the superficial perineal pouch as it relates to gland is the duct of the bulbourethral gland. If you go back to our lecture on the deep perineal pouch, you see that part of the structural component that we listed is the bulbourethral gland. We say that the deep perineal pouch in male is seen to contain gland, while the deep perineal pouch in female is seen with no glands. While in the superficial perineal pouch for female, we have glands. In the superficial perineal pouch for male, we do not have glands. So you can see how the presentation, of course, occurs. And we try to use this slide to also justify that presentation. So if you go back to the male up here, we say that within the deep perineal pouch is where we have the bulbourethral gland. This is what is seen to be highlighted also here in yellow. We have two. We have one on this side, and we have another one on the other side. Remember that this region here that is highlighted here in green is the deep perineal pouch. And of course, the region of the urethra that is seen to run through this space is the membranous part of the urethra. We've initially described the part through which the urethra run and also highlighting its different subregions. So on both sides of the membranous part of the urethra, we have the bulbourethral gland in male, specifically located within the deep perineal pouch. So this is what is presented here in this image. So if you go down to where we have the superficial perineal pouch, the structure that will be seen around this space is the dot of the bulbourethral gland and not the gland itself. So you have the dot of the bulbourethral gland, of course, extending into the superficial perineal pouch. And this is what is highlighted here in this image. So that whatever it is that the bulbourethral gland secretes will be released into the internal wall or the space of the urethra. And this is where it acts as a pre-ejaculate. So you can see how this presentation occurs. In the superficial perineal pouch for the male, we do not have glands. We only have the dot of a gland that is seen to be located within the deep perineal pouch. While in the female, the superficial perineal pouch is seen to contain gland and is seen to contain the Bartholin's gland. And this is what we've tried to highlight here using this slide. So let's use this slide to describe the neurovascular structures that are located within the superficial perineal pouch. Remember, using this image by the side, we say this is the pelvic cavity that is inferiorly limited by the pelvic floor or the pelvic diaphragm. We already have a demarcation here created that is highlighted here in black, where we further divide the perineum into the anterior urogenital triangle and posterior anal triangle. Within the anterior urogenital triangle, of course, positioned deep within the perineal space, we have the deep perineal pouch. And superficially here, we have the superficial perineal pouch. We've tried to highlight the different structures that are contained within the space as it relates to muscle and also viscera. While this slide will be using this to explain the different types of neurovascular bundles or structures that are located within the superficial perineal pouch. If you go back to this region, remember this is our anal triangle. Within the anal triangle, on the lateral side of the ischianal fossa, we have the pudendal canal. And this is what is highlighted here in blue. The pudendal canal can also be referred to as the Alcos canal. I've also done a very short video on the pudendal canal. This canal is created for the passage of the pudendal vessels. And this is why it is also referred to as the pudendal canal. So within the pudendal canal, we have the internal pudendal artery, and we also have the pudendal nerve. The internal pudendal artery is a branch from the internal iliac artery, while the pudendal nerve is one of the branches from the sacral plexus. So as these vessels and nerve emerge, you see them passing through the pudendal canal. That is the corresponding name canal that is located within the anal triangle behind. And this is where it is positioned. So these vessels are seen to give off a number of branches. And as these branches emerge, you see that they are directed into the deep perineal pouch. So you have some of these vessels going directly, as presented here in this image, entering into the deep perineal pouch. And you see them turning down, where they are finally seen to pierce the perineal membrane, which is the inferior fascia of the urogenital diaphragm that is highlighted here in red. And as they pierce through this structure, you see them finally gaining access into the superficial perineal pouch. It is not all the branches of the pudendal vessels and nerve that are seen to run this pattern, but most of these vessels are seen to run this pattern. It means that these vessels will be contained within the deep perineal pouch and also the superficial perineal pouch. If you see the pattern by which they run, you see them entering into the deep perineal pouch and also turning and piercing the perineal membrane so as to gain access into the superficial perineal pouch. And this is because most of the regions or structures that these vessels will be supplying are located around this region. So they need to pierce through the perineal membrane to enter the space where they can target the different organs or structures that they will need to supply. So if you try to go back to this table, we have a number of branches from the internal pudendal artery that is captured here at this point. So you have the artery to the bulb of the penis. You have a corresponding named artery in female, which is the artery to the bulb of the vestibule. You have the urethral artery. You have the deep artery of the penis, and you have the dorsal artery of the penis. All these vessels are emergence from the internal pudendal artery. And as they emerge, you see that they are directed into the deep perineal pouch before they are finally redirected to pierce through the perineal membrane, where they are seen to access the superficial perineal pouch. It means that these vessels will be seen as a structural component of the deep perineal pouch and also the superficial perineal pouch, considering the paths by which they run. You also have a number of branches from the internal pudendal artery that are seen to run a different path. So after emerging from the pudendal canal and are supposed to be directed into the deep perineal pouch, you see them just piercing around the perineal membrane here to gain access into the superficial perineal pouch. So you see that this group of vessels are not seen to enter into the deep perineal pouch because there's a bypass around this region. So you see them being released and piercing just the posterior region of the perineal membrane to access the superficial perineal pouch. So this collection of vessels are not seen within the deep perineal pouch. So if we go back to this table, this is where we have these branches here at this point captured at this region. So we have branches from the perineal artery. We have the posterior scrotal artery, and we have the transverse perineal artery. So these two arteries are not seen to run the same course with the previously highlighted branches. So you see that after their emergence from the pudendal or the Alcus canal, you see that they are released directly into the superficial perineal pouch. So this is what is seen to be highlighted here at this point. Then you also have the perineal nerve also taking this configuration. The perineal nerve is one of the branches of the pudendal nerve. So you see it also following the same trend and also aligning with the perineal artery. And they also give up the posterior scrotal nerve. They give up the nerve to the bulb of the penis and also muscular branches. So as they emerge, they're also seen to be located just within the superficial perineal pouch, considering the paths by which they run. And they also have a corresponding named nerve in the female. So you have the posterior labial nerve, you have the nerve to the bulb of the vestibule, and you also have some muscular branches. But just for us to know that the pattern by which they run, these vessels are just specific to the superficial perineal pouch. Unlike the previously mentioned branches up here, are seen in both the deep and also the superficial perineal pouch. Then finally, within the superficial perineal pouch, we have the long perineal nerve. This long perineal nerve that is highlighted here at this point is a branch from the posterior femoral cutaneous nerve of the thigh. This is also one of the branches from the sacral plexus. So you see a perineal branch also emerging from this nerve, and it's also located within the superficial perineal pouch. We also have the dorsal nerve of the penis that is highlighted here in this image. The dorsal nerve of the penis is the terminal branch of the pudendal nerve. This dorsal nerve of the penis or the dorsal nerve of the clitoris are seen just within the deep perineal pouch. And this is the pattern by which they run before they are finally seen to pierce the perineal membrane in the anterior part so as to access the penis where they will be providing innervations for. So you can see that depending on the pattern by which these vessels run, will determine whether you see them in both the deep and the superficial perineal pouch, or are just limited to just the deep or limited to just the superficial perineal pouch. So it's good that we're able to use this slide to illustrate this. So these are the vessels that are contained within the superficial perineal pouch. We know that some of these vessels are also seen within the deep perineal pouch, and it's good that we are able to illustrate this. So let's go to the clinical anatomy. There could be injury to the spongy urethra that is located within the bulb of the penis. We also try to use this image up here. You know that this is where we have the superficial perineal pouch. And we say that specifically, the region of the urethra that is located within this space is the spongy urethra. And this is where we have the deep perineal pouch. We said that specifically the region of the urethra that is located within the superficial perineal pouch is the spongy urethra. And this is the spongy urethra here, arrowed at this point. Specifically, it is the upper part or upper region of the spongy urethra that is located around the bulb of the penis. So if you have injury to this region, it means that there could be accumulation of urine in the superficial perineal pouch first. And this accumulation of urine, of course, will be seen to extend from this region. And this is as a result of the deficit that is created in this anterior part. Remember during the course of this lecture, and when we try to describe the boundaries of the superficial perineal pouch, we say that anteriorly there is an opening. So this deficit will allow for the movement of this urine to run to other regions of the body. So there could be the movement of this urine to extend up into the abdominal space, could also seen to run inferiorly into the scrotum, or it could be seen also to run into the upper part or upper region of the thigh. So you see that the urine that is accumulated within the superficial perineal pouch due to this injury will be able to move out of this space through this deficit that is created in the anterior part. And this is where we try to use, the structural configuration of the perineal pouch to also explain the circumstance that surrounds some disease conditions. So thanks for watching this video. Let's continue to stay glued to this channel.